everyone, and welcome to today's webinar. Thank you so much for joining us. I am Aubrey Villalobos, and I will be talking today about aligning state cancer plans with national priorities. So I am the new director for comprehensive cancer control at the George Washington Cancer Institute. I've been here since September and have really been enjoying working with all of the comp cancer programs and coalitions so far. And so I will just give you a quick overview. This is going to be a pretty nuts and bolts webinar for you. We're going to talk a little bit about the public health priority landscape, the methodology and development of our new priority alignment tool, the contents in the tool, and some applications for cancer control work. So in 2013 to 2014, we conducted a needs assessment among comprehensive cancer control programs and coalitions, and we repeatedly heard that a challenge in drafting state cancer plans and annual action plans is the broad national landscape of priority health topics and seemingly ever-changing focus. On top of that, it seems that different organizational bodies all use different words and metrics to get at the same general thing. This can seem like even more of a challenge when you consider partnering with other coalitions, organizations, and stakeholders from beyond the comprehensive cancer control world in order to improve integration of cancer and chronic disease public health efforts. Today, I challenge you to think of this as an opportunity rather than a barrier to collaboration, and we hope to help support you in your state cancer control planning and chronic disease integration efforts, starting by developing and sharing this state cancer plans priority alignment tool. To develop the various priorities and indicators in the State Cancer Plans Priority Alignment Tool, the GW Cancer Institute compiled national health priorities and indicators from sources released by the following organizations. We use 4 sources from the Centers for Disease Control and Prevention, including the National Comprehensive Cancer Control Program Priorities, which you are all very familiar with, the Cross-Cutting Disease, Chronic Disease Indicators, the Prevention Status Report, the National Action Plan for Cancer Survivorship, 2 sources from the U.S. Surgeon General, including the National Prevention Strategy and the U.S. Surgeon General's Call to Action to Prevent Skin Cancer. We used Healthy People's 2020 Leading Health Indicators and the Comprehensive Cancer Control National Partnership's 3 priority focus areas, as well as Livestrong Foundation's Essential Elements Brief on Survivorship. We compiled the various indicators and priorities from these sources into a single spreadsheet and organized and collapsed them into priority categories. This spreadsheet shows which sources emphasized which priority areas. Since the focus of this resource is helping comp cancer programs and coalitions with cancer control planning, the chronic disease priorities that related most to cancer were given more weight. For example, chronic diseases such as heart disease, diabetes, and arthritis are not included in this tool because although they are often cancer comorbidities, they are not primary risk factors for cancer, while poor nutrition, physical inactivity, and obesity are. The GW Cancer Institute distilled the priorities to a handful of cancer and chronic disease priorities based on the frequency at which they were mentioned across the sources, coupled with diseases that are highly preventable. In addition, weight was given to priorities where there are known gaps and where current windows of opportunity exist in the public health field related to increased attention, policies, and funding. The finalized list of priorities in order of frequency and weight given are as follows. Cancer topics include colorectal cancer, specifically screening, cervical cancer, and specifically HPV vaccination coverage, skin cancer, lung cancer, and survivorship. Chronic disease topics include nutrition, physical activity and obesity, tobacco and alcohol use, access to health services, and mental and emotional well-being. We use the same method to prioritize approaches or strategies for addressing priorities. We use sources from the U.S. Surgeon General, CDC, and prominent Institute of Medicine reports and compiled the approaches into a single spreadsheet. Again, we collapsed and distilled them to 11 approaches: policy, systems and environmental approaches, communication, education and training, epidemiology, surveillance and information technology, health disparities and accessible and affordable care, healthcare coordination, managing illness and shared decision-making, prevention and early detection, psychosocial health needs, workforce improvement, community clinical linkages, and quality improvement. So now let's take a look at the priority alignment tool. It is available as an interactive PDF, which we'll go through next. You can access the PDF through our technical assistance portal or at the shortened direct link above. It might be helpful if you follow along. So the contents, this 35-page document is organized into the following sections: an introduction with background and methodology, the tool itself, a glossary, sample indicators, targets, goals, objectives, and evidence-based or promising activities, and a listing of other useful resources. Let's take a look at the tool itself. There are a few sections. It is a fillable PDF form, so you can download, fill it out, save, or print. The first step in the tool is to take a look at your current state cancer plan and identify which national priorities are currently addressed in the plan. You can check the boxes and then make a note of the goal or objective number in the text box on the right. Step 2 is to assess the strength of your plan's alignment with the national priorities. Thinking about the importance given to each topic in the state cancer plan and the effort and activities exhibited by the State Cancer Control Program, coalitions, and partners, you will rate alignment on a 4-point Likert scale from no alignment to strong alignment. For example, a weak alignment indicates that the priority is present in the state cancer plan, but there are no planned activities in the next 12 months. Strong alignment, for example, indicates that the priority is in the plan and activities are currently being implemented. After you complete the assessment, you can summarize your results to determine where your plan has strongest alignment and where you have opportunities for improvement. To improve your plan for its next iteration, you can choose one of your areas that had weak or no alignment from the drop-down menu and proceed to write a new goal around that topic. Right in the tool, we provide some basic guidance from the CDC on goal writing, but there are also examples from each priority area in the larger document. Following goals, you will draft objectives and strategies for each priority area you wish to improve upon. The document also includes a glossary section. Here we provide more information on each of the priorities and approaches, including how the sources define them and what the windows of opportunity are around the topics. For example, about colorectal cancer, we say that while there are national indicators and general priorities surrounding incidence and mortality of colorectal cancer, the current focus of national agendas is on increasing recommended colorectal cancer screening. In particular, both the CDC and the Comprehensive Cancer Control National Partnership have priorities for increasing colorectal cancer screening based on the latest guidelines. Further, the American Cancer Society and the CDC's National Colorectal Cancer Roundtable launched the 80% by 2018 movement with the goal of reaching 80% of recommended individuals getting screened for colorectal cancer by 2018, providing an opportunity for public health professionals to make a collective impact. In the samples section, we provide example indicators, targets, goals, SMART objectives, and strategies from past and current state cancer plans, as well as additional examples from GW Cancer Institute's experience in the field. This section is particularly useful for you when drafting new goals on the priority alignment tool itself. Let's look at an example from the tobacco and alcohol use section. And I'm going to pull my document up here, and if you want to take a second to do that, you can do so also. So on the tobacco section, you can see that some potential indicators include adult cigarette smoking rates, sale of cigarette packs, adolescent cigarette smoking in the past 30 days, smokeless tobacco use among youth, adolescent use of alcohol or illicit drugs in the past 30 days, binge drinking, etc. Some potential targets come from Healthy People 2020. For example, to reduce cigarette smoking by adults to 12%, or reduce the use of cigarettes by adolescents in the past month to 16%, etc. You can also see here that we have an example from the Arizona Cancer Coalition's 2005 to 2010 cancer plan with a direct link to their plan itself. But their goal was to reduce the risks for developing cancer among all Arizonans by prompting and engaging in healthy behaviors with a specific objective and targets around tobacco. and their strategies were to disseminate public education messages about the role of alcohol and cancer risk by educating Arizonans about the relationship between alcohol use and cancer, etc. Here's an excerpt from the survivorship section. I know a lot of people have questions about what the best targets and indicators are related to cancer survivorship. So we provide some examples and real examples from 4 state cancer plans, plus our own 2 cents. So you can see that some potential targets for survivorship come from the Commission on Cancer, and that Commission on Cancer accredited institutions will provide survivorship care plans to 25% of eligible patients by January 1, 2016. There are also some Healthy People 2020 targets that are relevant for survivorship, including decreasing to 12% the proportion of persons who smoke, and this would include cancer survivors. Increasing the mental and physical health-related quality of life of cancer survivors, and increasing the proportion of persons who report that their healthcare providers always involved them in decisions about their healthcare as much as they wanted to 56.8%, and that would include cancer survivors as well. There are also nutrition and physical activity guidelines for cancer survivors that were developed by the American Cancer Society, and so those are also good targets to consider, such as increasing the proportion of cancer survivors who would achieve and maintain a healthy weight, and increasing the proportion of cancer survivors reporting at least 150 minutes per week, and etc. So some of these you'll notice are SMART, some of them are measurable, and some are not. I know Healthy People 2020 includes a few developmental targets because the field of survivorship is relatively new and there hasn't been a lot of research in this area yet. Some of these targets are developmental, but we do have a good menu here of options for you to choose from. The final section in the document is a list of resources that are helpful for more in-depth state cancer planning. Some examples include a comprehensive list of population-based data sources. So these are all of the national data sources and some other sources that you could possibly use for getting the data that you need to make your objectives SMART and actually measure them. We also include cancer plan development resources. So you may have noticed on the lobby loop coming in, the GW Cancer Institute has a state cancer plans goal bank that we released in January, and this website includes filterable and searchable list of all of the goals from all of the publicly available state cancer plans. So you can go in and search by topic or keyword or stage in the cancer continuum and find examples of goals from current and past plans from all of the states and see what your peers have included on certain topics. We also put out a new resource called the Comp Cancer 101 Wiki in January, and the first section that we released in that wiki is the planning section. And that website think of it sort of like a living document that collects all of the wisdom of various cancer control programs across the country around cancer planning, and you can go there to see really nuts and bolts answers for who and how things get done around cancer planning in different areas. We also recommend that you look at the CDC's Cancer Plan Self-Assessment tool. That tool will walk you through a lot of the structure of how to revise and update your cancer plans. And the CDC recently released the Library of Indicators and Data Sources, LIDS, which should be available to you through the CDMIS system. And that database includes indicators and data sources that you would be able to use on the various topics and plug right into your cancer plans. There's also a resource that is a template to help build SMART objectives, and then there are a number of other resources that we provide at the end of the document. So we hope that this tool will be useful for you to increase your own awareness and your program's awareness of national public health priorities and which may be the most important at this point in time. We also hope it will help you assess your current cancer plan for alignment with the priorities and integrate into your cancer plan revision process to ensure inclusion of national priority topics in your new plan. And we hope that it will be a good source of ideas and examples of goals, objectives, indicators, and targets that are in these areas so that the next time you're revising your plan, it's a little bit easier for you to do. So this, I know, was probably one of the quickest webinars you've been on in a long time, and I know this was a very quick trip through the priority alignment tool and guide, but I wanted to save plenty of time for questions, and so I'm happy to take questions at this time. You can type them into the question pod, and we will answer them one at a time, and we will be here through the rest of the hour to answer your questions. So thank you so much for coming and joining us today, and we hope that you will visit our website and subscribe to our e-newsletter so you can hear about new products that we have coming out, as well as following us on Twitter to hear about all of the latest technical assistance that we put out. So at this point, I will answer the first question that came in. And yes, I apologize. I should have mentioned this at the top of the webinar. The number one question on webinars, will this presentation be distributed to participants? Absolutely. We will send the slides out at the end of the session. We'll make sure to send an email to everyone with a copy of the slides for sure. I hope everyone can see the Q&A pod, so if you do have questions, feel free to send them in. You'll also notice at the top of your screen that we do have a pod for web links, and so that's where you can go to see the link to, first of all, our evaluation survey. We would appreciate if you would take that, but also to continue the discussion on R2R. If you think of a question that you don't get a chance to ask today, please feel free to ask on R2R, and we will make sure to answer there. And there are also direct links to the CDC Cancer Plan Self-Assessment Tool and our Goal Bank and Wiki, and an archived webinar that we held in January that talked about the self-assessment tool as well as performance measures and monitoring of progress on your plan. So a question came in that says, how are your efforts in outreach of education linking up with the work American Cancer Society is working on? So that's a great question, and I'm not sure if you have more specific information on that for what region you're in. We speak regularly, I think quarterly, with the American Cancer Society. We are both technical assistance providers funded by the Centers for Disease Control, and we are working with the CDC to make sure that our efforts are synergistic and collaborative and not duplicative. And so you know, the work that we're doing in terms of outreach and education should be on different topics or in different formats for sure. I didn't mention this during the webinar. I probably should have. We did pilot test the priority alignment tool with a few states. I don't want to call them out, but we took feedback. They used it during their revision process, and we incorporated a number of their changes into the final version that is now available. So it was pilot tested, but we are happy to take feedback if there are additional comments that you have or suggestions. We would be happy to take those as well. Okay, so we're not having any more questions come in, so if you do think of a question after the fact, please join us on R2R to continue the discussion, and we would really appreciate if you would fill out our evaluation survey. That helps us out a lot. And one question came in: do you have any advice for a state who has an integrated approach for chronic disease prevention, health promotion work? We really link tobacco and obesity with cancer prevention work, but this can be hard to do when direct service is a big part of the picture, really moving to community clinical linkages and health systems transformation. Yeah, so I think that the cancer and chronic disease integration is, as I said at the beginning, I think we should see it as an opportunity, not a challenge, for sure. Physical activity and nutrition, a lot of those are included in the, excuse me, in the priority alignment tool itself under the chronic disease category. And I think one of the efforts that we've got going on in 4 locations over the next 3 years are some community roundtables in partnership with area health education centers. And so we're trying to tackle just that question of how do we get the comp cancer folks and the chronic disease folks working together to advance topics that we're all concerned with, right? There is a lot of overlap between physical activity and nutrition and the tobacco and alcohol use and the access issues and the mental and emotional well-being that is not just relevant for cancer control, it's relevant for a number of diseases. And so I'm not sure that we exactly have the answer yet. We are hoping to try some things out with these community roundtables and learn an awful lot, and we will be sharing that over the next 3 years as we have lessons learned. But I think that getting the partners into the discussion to make sure that, you know, when you're doing your state cancer plan, and, you know, because that's a requirement for you to submit, but making sure that it very clearly aligns and overlaps with what's in the chronic disease plans and the other organizations and partners, see how the activities work towards a common goal. You know, one may say to reduce cancer incidence and another may say to reduce diabetes, but really you're all working together on physical activity and nutrition solutions, and that's what matters. The collective effort. So I would just say making sure to have all the right people at the table early on in the planning process and trying to make sure that everyone agrees on the language. But yeah, we will keep you posted if we have any additional nuggets of information from the 4 sites. We're working in Vermont, Kentucky, Florida, and South Dakota for the community roundtables. Thank you for your questions. All right, if we don't have any more questions, I will happily give you back the rest of your afternoon. Thank you so much for your time today, and please do feel free to ask additional questions on R2R or email us if you have feedback on the priority alignment tool. Have a wonderful afternoon.